Good Sunday morning, everyone. I'm Stuart Ledbetter, and this is NBC5 In Depth. If you've needed to see a medical specialist the last couple of years, you may have waited a long time. In Montpelier, a multi-agency investigation this week confirms what the newspaper 7 Days initially reported last September. Hospitals say they are trying hard to recruit more doctors and acknowledged they must do better.
Unfortunately, especially here in Vermont, there are just not always the right number of physicians and nurses and other staff in every specialty to make sure that always happens. There just isn't.
The COVID-19 pandemic has clearly made things worse. One of the key players involved in drafting the report is with us this morning. Joining us this morning, the Commissioner of Financial Regulation, Mike Pieciak. Welcome back to NBC5 In Depth.
Thank you, Stuart. It's a pleasure to be with you.
Happy to have you. So the results are in from the state's initial examination about the long wait to see a doctor, particularly a specialist. And essentially, you confirm this is real.
Yeah, that's right, Stuart. I mean, we spent the last 5 months trying to quantify this problem. We started by hearing from Vermonters. We had public listening sessions. We invited Vermonters to share their stories with us. And those stories were really, challenging and heartbreaking to read. People having challenges accessing care, people talking about how their health deteriorated as they waited for care, that they waited for care in pain, both physical and emotional. So those were challenging stories. And we expanded our scope out to providers that really confirmed the same story, that they were having challenges getting their patients to specialty care. And then we tried to go beyond that and really quantify the problem by looking at claims data, looking at charts from providers, and looking at a secret shopper program where we called over 1,000 different providers in Vermont to try to quantify the wait times from the perspective of a Vermonter trying to do the exact same thing, call a specialty and get an appointment. And they did show that wait times were long for certain specialties and that Vermont was not measuring well to national benchmarks.
Well, the hospitals pushed back a little bit on that. They aren't sure that that was entirely fair to essentially cold call specialty clinics during a pandemic when their capacity was limited. Some of those providers, could have been out with COVID, for example. Is that, do you think it was an accurate reflection of the way things are now?
So the challenge with wait times is that there is no standard for measuring wait times, whether it's in Vermont or nationally. So our approach took 3 different methods to quantify wait times. We did the secret shopper program, which was one of the methods. We did this claims analysis, which was another. And then we did this chart review of patients' charts and how quickly they were able to see a specialist. All 3 of those analyses were done by different teams, and they independently arrived at the conclusion that wait times were long. So take any one of those in isolation. There are things that are strong about the analyses. There are things that are limiting about the analyses. But again, taken together, they really paint a picture that gives volume to the voices that we heard from Vermonters, that there is real struggle out there in terms of accessing care. And most importantly, we need to do better, all of us, state government, medical community. It's an important issue. The VA, for example, looked at this issue a number of years ago. They put their shoulder into it. They made significant improvement, and we can do the same thing here in Vermont and be a national leader on access. So that's really where our focus should be.
I'm wondering, this didn't start with the pandemic, right? We have an aging population that requires more and more health care and an aging community of providers as well. And so this, you can see where this is going.
Yeah, exactly right. So one of those analyses we did looked at the claims data prior to the pandemic. It looked at 2017, 2018, 2019. And for each one of those years, we found that the average wait time was about 100 days from seeing your primary care doctor to seeing a specialist for that referral. So that predates the pandemic. It was pretty consistent in terms of the length of time, and definitely something that we can improve upon, certainly going forward.
UVM has got a plan to recruit aggressively to get more of the specialists that they need in the door. They just this week announced a big pay increase for 2,000 nurses effective immediately to try to improve retention and be more attractive. Smaller hospitals, though, say they really struggle to get a specialist in because they cannot afford to pay a competitive salary, and they lose people who are finalists. Is that a real challenge that sort of will be passed up the food chain and will be reflected in budget approvals, do you think, at the Green Mountain Care Board?
Yeah, so that's a very real concern. When we looked at specialties, we did find certain specialties where the demand for services was greater than the supply in Vermont. So even as we stand now, there is more demand for certain specialties than there was doctors to provide that specialty care. And to the point that you made, Vermonters are getting older, and for certain of those specialty care, they're going to need more of it. And the provider community is getting older. Our analysis found that from 2010 to 2020, the amount of providers over 65 increased from 8% to 18%. So that means they're working fewer hours. We determined that as you get older, even if you're working and not retired, you tend to reduce the amount of hours that you're working and seeing patients. But then you very well may retire over the next 5 to 10 years. So this is a challenge that is going to be with us and get worse. It's why we need to address it now. But in terms of recruitment, it's not a Vermont issue alone. Specialists are getting older across the country, and we are competing for fewer of them. So it is something we need to look at the state to make sure that, we have what we need and hospitals have what they need to be competitive and get those specialists, but also to be nimble and try to find other ways to provide care without increasing costs.
Let me ask you about something that the head of the state's largest health network said, that in Vermont we are different in how we approve major spending. Dermatology, Dr. John Brumstead pointed to, we could use a new building that could accommodate a whole lot more patients in a specialty that has long wait times, and yet we can wait a year or longer to get a certificate of need, a CON, to build that thing.
I would ask that as part of the access report that's come out, that we not just look to the delivery system for all the solutions, but that we look directly at the processes, the regulatory processes in the state of Vermont, and make sure that those are not impeding our ability to address the access issues for Vermonters, but are facilitating and enhancing those efforts.
Does he have a point?
So, Vermont is regulated differently than many other states, maybe unique among any other state, with the Green Mountain Care Board having authority over hospital budgets and that certificate of need process as well. As part of this analysis, the Green Mountain Care Board was an equal partner. They were important in terms of driving the results of this finding. And they also turned the spotlight on themselves. And in the report, they referenced that they need to find ways to be more efficient, to provide an easier opportunity for the industry to get some of those services to Vermonters. So, they are recognizing that they may need to make some changes as well. So that is something that's certainly contemplated in the report.
So it sounds like this issue has everyone's attention now, but it's not a quick fix.
It's not, unfortunately. What we're telling Vermonters now, you need, if you're confronting a long wait time and you have the ability, call around and try to find another specialist, another provider, because we did find great variability between specialists. In one instance, a dermatologist could see us in 11 days. In another instance, it was 410 days. So there's great variety within this, the calls that we made in terms of the results. So do shop around to try to find a wait time that fits your needs. But in the meantime, and in the long run, the state needs to work with the stakeholders, the medical community, and make some real progress on this issue. It will take time. We want people to be patient, but it's on our radar, and it obviously is a significant priority for us.
In your other role as the modeling, COVID-19 modeling chief for the state these last 2 years, the news seems to be getting better and better. Are we now moving to the endemic phase of this?
Yeah, it's a good question. I mean, a little bit depends on how you define endemic, but what we do know is that we're down 85% in terms of our cases from the peak of Omicron. We're down 37% from the peak of our hospitalizations from Omicron. We haven't yet seen our fatalities level out, but we do expect that to occur over the next, 2 to 3 weeks. That the fatalities will start to come down, and that will be the last metric that we'll see improvement. It's a lagging indicator, unfortunately, but we do see clear improvement in Vermont. We see clear improvement regionally. The other international jurisdictions where Omicron hit, they have seen sustained improvement in terms of their trends as well. So there's all the reason to believe that here in the short run, things are looking very optimistic. Now, of course, COVID always throws curveballs, and we want to be on the lookout for any new variant of concern, but there isn't one on the horizon as of now.
Mike Pieciak, the Commissioner of Financial Regulation. Thanks for being with us.
Yeah, thank you very much.